Om Swastiastu, Dr. Arika. My name is Artika, and we are from Group 4. Thank you for sparing your time to watch our presentation about journal appraisal today. And we look forward to any feedback from Dr. Arika may have. So our journal's names is Dove Press Journal, Clinical Cosmetic and Investigational Dermatology, published in 2017. And the title topic is glutathione and its anti-aging and anti-melanogenic effects. Next slide. Here's are the member of our group. They are Prima, Melanie, Nayaka, Artika, Aquila, and Faris. Next slide. Here's are the contents of our presentation today. Next slide. Okay, start from the introduction. I believe Dr. Arika already know about glutathione, or maybe you already use in your beauty products. So in vitro experiments was demonstrated that glutathione is related to melanogenesis and assess certain anti-aging in skin properties. So the main objective of this study was to evaluate the influences of both reduced glutathione or GSH and oxidized or GSSG at doses 250 milligrams per day for 12 weeks. And this dosage approved by Thai and Taiwanese Food and Drug Administration, and this dosage and the glutathione is going to improving the skin properties. For the patient and the methods, this study used randomized, double-blind, parallel, placebo-controlled, and also three-arm study. The subjects was randomly separate into three different groups, which are GSSG, GSH, or placebo. 60 healthy female volunteers aged between 20 and 50 years are enrolled in this study. Daily dosage of GSSG, GSH, or the basic calcium phosphate as placebo in a capsule provided by Kyowa Hakko Bio Company Limited in Tokyo, Japan. And each group have the same total of capsule weight. Next slide. To objectively evaluate the skin properties, the study assessed some skin condition ranging from the melanin index determined by mexameter with sun exposed area, and there's also water contents that measure by corneometer, transepidermal water loss measured using tewameter. Here's the VCR-CR system will determine a UV evaluation, spots, pores, and also the evenness of the skin. Elasticity measured by cutometer MPA 580, and also wrinkle measured by Visioscan. To subjectively evaluate the skin properties, the study using 4-point rating scale. 4 for very satisfactory, 3 for moderately satisfactory, 2 for minimally satisfactory, and 1 for not satisfactory. For the subject safety, vital signs, complete blood cell chemistry, and also lactate dehydrogenases were determined at each visit. In statistical analysis, PRT tests used to compare the baseline values with the vinyl visit and the efficacy of GSSG, GSH, and the placebo pre and post treatment was performed by GEE or generalized estimating equation. Next slide. For the results, start from the melanin index. The melanin index and UV spots of all sites that get exposed or unexposed by the sun from the GSSG and GSH group are lower than placebo group. But statistically, there is no significant difference. For the transepidermal water loss and the water content, the sun exposed right forearm of the GSH group was significantly lower than GSSG group. For the wrinkles, sun protected left arm for the subject left arm, and for the subject age over 40 years with left arm sun exposed in GSH was significantly lower than the placebo group. And for the elasticity, the GSSG and the GSH group tend to increase the skin elasticity. However, in statistical, there is no different uh, that can be demonstrated. Beside all of the result, in this study, there was no serious at first, but there is some adverse reaction, such as pruritus, macular erythema, uh, transient minute of red spot on the skin, and also tiredness. The author also leave a note that further study in larger and more diverse community is warranted. Next slide. Okay, for the validity will be presented by Melan. Thank you.
Okay, thank you, Artika. So next I will start discussing the results of our article analyze. So we analyze this article with using VIA method, which stand for validity, important, and also applicability. So this method can help us to answer important question like, is this research trustworthy or not? Is this method appropriate or not? Do the result make sense or not? And also, can we apply this in practical or not, like that? Okay, first let's talk about the validity. So in analyzing validity, we look at the several aspects like level of evidence, internal validity, external validity, reporting ethics and transparency, and also the method. So first let's look for the level of evidence of this study. So as you guys can see, this study used a randomized control trial or RCT study design. So this is the strongest types of experimental study in a evidence-based practical like that. So RCT are reliable because they can reduce bias and also show cause and effect clearly. And in this study, using RCT study design are appropriate because it can evaluate how the glutathione affects in skin condition like spore, evaluate the pigmentation, wrinkles, and also elasticity, which require careful control and also fair comparison with the placebo group. And now, if we look at the internal validity, so internal validity of this study was quite strong or has a good strength. Why? Because the first thing for the participant of this study was randomly assessment, and then most of them was complete this study, and also the group had a similar characteristic at the beginning, and also the result were measured consistently. So all of this factor can make this research more reliable. So that's why we said for internal validity that has a good strength because all of this factor like that. Okay, next. However, for external validity, so external validity of this study, there are there are has some limitation. Why? Because as you guys can see, for the participant of this study was only include Asian woman age 24 20 to 50 years from one geographic location. It is Bangkok, Thailand. So it's mean for the result of this study, they may not be applicable to the men or to different age group or to people from different ethnic background because the study had the limitation for the participant. And then for regarding of reporting ethics and transparency, so this study received ethics approval from appropriate institution and also follow the Declaration of Helsinki. And this study also clearly reported the funded came from Kyowa Haku Bio company. So that is the company who the product the glutathiones. Even though the authors say there is no conflict of interest about that, but the fact that this study was funded by the product manufacturer, it means that there is still a potential for bias that should be considered. So I think that's all can I explain about the validity. Next validity for method appropriate or not will be explained by Nayaka. Thank you.
Okay, thank you for the opportunity. So as of now, I'm going to continue the validity. from the validity point of view, starting from the population itself. Okay, from the population itself, the study already sampled from 60 healthy female subjects voluntarily aged between 20 until 50 years old that has been recruited from a dermatology clinic located in Bangkok and Thailand. And the population that they need in the sample has their own criteria. For the inclusion criteria itself, the population must be healthy. They were assessed by their medical history and also their physical examination. And during the study itself, the population cannot consume any medication or any supplementation that they usually use. And for the exclude, although the exclusion criteria were not explicitly explained in the study, but there were three populations that cannot participate in the study because of the abnormality laboratory result and also the indication of using any contraceptive pills. And as you can see, there in the table itself, there are uh, some details from the population itself. There are some age distribution, hair colors, skin phototype, homogeneity, and also the treatment itself. There are three treatments that they use, the GSSG, the DSS, and also the placebo itself. Okay, next slide. Okay, for the next one, the study itself used a block randomized, which means that the allocation of the subject itself split into three groups, the GSH, the GSSD, and also the placebo. And the allocation procedure or the randomized procedure was explained quite clearly. However, the randomization method, such as computerized randomized or sealed envelope, was not described in detail, and this could be a minor drawback in terms of methodological transparency. And for the next one is the control. The control itself, the study using a placebo, while the placebo itself containing the basic calcium phosphate, identical in appearance, size, and also packaging itself to the GSH or GSSG capsules. And the total capsule weight was standardized to ensure uniformity. And the design the placebo in bias. And the next one is the blinding. The study itself and the next one is blinding. While from the study itself using a double blind design where neither the participant nor researchers knew the group assignments. So identical capsules and packaging across groups were central to maintaining the blinding itself. Okay, next slide. So overall, from the validity point of view, the study demonstrates a high internal validity through the use of a robust methodological, such as the block randomization, double blinding, and also objective measures, and a high participant retention. Although there are some limitations from the external validity, such as the homogeneous sample that they use in the study sample. And there are also some limitation in the methodological transparency assess the remediation method in details. And despite this limitation itself, the study had strongly support the anti-aging and also the anti-melanogenic effects on the glutathione study on the population sample in the study, and need further research for the and in more diverse population. Okay, next slide. Okay, for the next topic, I will hand it over to my partner. Thank you.
Okay, the next thing we want to discuss is the importance of this study that will be represented by the statistical analysis of this study that will answer the question, are the result is big enough or meaningful enough to matter in real life. Okay, so here is the quick overview of what we have been evaluated from this study from the analytical aspect or statistical aspect. The first one is the statistical methods that we found it is appropriate and robust, which is strong. The second one is the p-value that we found it is quite properly calculated and interpreted. And the third one is the confidence intervals, which we cannot find anywhere in the study. So we can conclude that it is not reported or will be the limitation later in the study. And the alignment with the conclusion, we found it is generally appropriate and cautious. And the text below is the explanation of how this methods works, but we will discuss it later in the next page that will make it easier to understand. So this study randomized the participants into 3 different groups: GSH, GSHG, and the placebo. After baseline skin measurements, they received oral supplementation for 12 weeks, and they got follow-up measurements at weeks 4, 8, and 12. And for analysis, they're using paired t-test to know and look out at the changes of the group. And they use GEE, or generalized estimating equation, to know the difference over time between the groups, and they use ANCOVA for subjective assessment. For the interpretation of the results, they use p-values, and there was no confidence intervals were reported. For the conclusions, overall, GSH shows a significant improvement or changes in skin pigmentation, wrinkles, and skin moistures, especially for those who have age above 40. So the next one is the effect size. So this study uses continuous outcomes that is not binary. So it is presented by a scale. So we cannot describe the result as a yes or no, or a binary number such as 1 or 0. So if we look at the checklist, we cannot use the method such as relative risk or odds ratio, because it is not binary. It has to be binary to use that. So the authors use GEE instead, and it is appropriate because it accounts repeatable measurements and from the same individual. So it is appropriate. And the mean difference here, they use mean difference to evaluate the effect size. It is used properly. The wider or the bigger result of the mean difference means the bigger the effect is. But it has some limitation. It only, the GEE only estimates a population level effects. It cannot modeling individual variation, and it always relies on or depends on the correlation structure or working correlation that have been assumed before. But in this case, as mentioned before, the main goal is population level inference, and the sample size was quite moderate. It only 60 subjects initially and 57 completed. So the result is valid at the low population level, but we have to take note that at this absence of the individual level modeling or the reliance or dependence on the population averaging, we have to be cautious when it comes to generalizing the findings, especially with diverse patient population. Okay, so then the next one is the statistical significance. As you can see, the study defined the p-level, the p-value the p-value that under the 0.05 as the threshold for statistical significance, which aligns with standard scientific practice, as we know. If you can see at the table 3, which is the interpretation of placebo versus GSH, we can see that the p-value overall is below the 0.05 at 3 aspects: the reduction in melanin index, the wrinkle reduction, and the increase in skin moisture, which is this data is come from the participants that older than 40 years old. And the mean difference shows a significant result. It above 0, and the number is quite big, especially in the moisture of the skin at the participants older than 40 years old. So the authors correctly interpreted the p-values, and they emphasize statistically significant result appropriately. And they cautiously describe non-significant results, as you can see here, They use a term trends rather than making unsupported claims. Okay, so the last one is the confidence interval, which we cannot find it anywhere. It is not calculated, reported, or discussed anywhere in the study. So only p-values and mean difference were reported, and without CIs, we cannot know or determine whether the statistically significant result, which is the p-values before, were based on the narrowly or widely varying data. And the strength and stability of the evidence that supporting the study findings there cannot be fully evaluated. For example, if the study had reported that the melanin index decreased by 60 units with a 95% CI of 58 to 62, this would suggest that high precision and strong confidence in the result. But conversely, a CI of 20 to 100 would suggest that substantial uncertainty in the study, even if the p-value was statistically significant below 0.05. Okay, so overall, the author's conclusion were responsible and appropriate given the statistic they reported. They only claimed significant effects where p-values were less than 0.05. They clearly acknowledged that not all outcomes were statistically significant, and they also recognized the limitation of their study, including some small sample size, the homogeneous study, and the relatively short 12-week follow-up period. So the discussion is correctly emphasized that further studies are needed to confirm and extend their finding. Okay, next one about applicability will be presented by Faris.
Okay, thank you, Prima. Okay, on the applicability slide, several points were highlighted, and then number one, the study use female participant from dermatology clinic of King Chulalongkorn and all from Healthy Talk medical examination, and participant from ASEAN, specifically from Bangkok, Thailand, because representing typically Southeast Asian skin types, and the study focused on women aged 20 to 50 years because they are the main users in skin whitening product. And glutathione is available in clinic or pharmacy as capsule or injection, and with generally a very affordable price. Okay, next slide. Okay, and for the research is highly likely, especially especially involving male subjects or different race or optimal dose or duration of therapy or long-term effects, glutathione use. And next slide. Okay, next slide will my friend speak.
Okay, thank you, Faris. Next, we discuss about strength and limitation. The study have several important strengths. First, randomized controller trial or RCT design. The study use methods with randomized, double-blind, and placebo control method, which is golden standard for clinical research because it's reduce bias and improve the result. 2. Objective measurement. The study used tools like a mexameter and PCR to assess skin parameter. This tool can be helped in objective result and accurate data. 3. Relevant and clear clinical question. The study tackle relevant clinical question about glutathione, anti-aging and pigmentation effect. 4. Unique comparison of GSH and GSSG. The study compared between GSH and GSSG of glutathione, offering something new that is not common in previous research. However, the research also had some
limitation. First, limitation general ability. The sample limit to help Asia female between age 20 and 50 years, and all participants live in a single site in the Bangkok. This limit not general for another population like different ethnic, different gender, and another age group. Two, small sample size. The sample size was relatively small, only 57 participants completed the study. This can reduce the potential important clinical effect. Three, funding source from manufacturer. The study funded by a company that produces glutathione can be facing the potential for bias. For side effect from oral glutathione. Glutathione have a small side effect like pruritus, macula erythema, and another side effect. Next slide. Conclusion. The study provides pre-eliminated evidence suggesting that oral glutathione supplement both GS8 and GSSG may improve certain skin parameters related to aging and pigmentation. However, due to its methodological limitation with no CI method and question around clinical significance, future large-scale diverse population studies with clear reporting standards are needed before firm conclusion can be drawn regarding glutathione effectiveness in clinical practice. Next slide. Okay, that's all for me and my team. Thank you for attention. Thank you.